So, first important thing that you have to understand from this point of view preparation is there's no new reading. It's all whatever you have done so far in this, 6 months or 1 year, or how long you've been preparing. So, this is all going to be a recapture of whatever you have done, a revision of whatever you've done. So, there is no new reading from now on. Okay. And you have to have a strategic approach towards these last few days of the exam. So most of you would have applied for your leave or taken off from your work, and basically you're not into active practice or doing operations or such things. So try to take away these 2 weeks at least until your exams, so that you completely make yourselves avail for this part 3 exam. This is an important milestone in your career. So see to that you give your 200% at least these few days, if not you have not before. Okay. So arrange everything at your work, with your appointments, with your patients, with your hospital, apply leave, and if even if you're not applied so far, let it not be delayed. So try to apply as early as possible and try to avail the leave. Speak everything with your family. um, Arrange everything for the child care, and speak with your husband, or speak with your spouse, and then arrange everything which is needed, so that you're devoting all your time towards this exam. Okay. So take support from your extended family members, your friends and neighbors, or whatever is your social setup, so that you are totally available for this exam. Okay. So divide your study time into, nobody can do a marathon studies like 5 hours or 8 hours. No human being can do it. So generally try to have a healthy routine, as well as see that you're not sleep deprived. This is very, very important. Okay. So whichever is your study pattern, like whether you are early lark or night owl, it's totally upon depends upon you. Generally, whatever is your study schedule, see to that you don't study more than 3 to 3.5 hours, or at the most 4 hours at a stretch. Take adequate breaks, hydrate yourself well, have some healthy food, avoid junks, avoid seeing too much of internet or mobile. Like if you're in the habit of, like, you want to de-stress, so try to listen to some good music, or spend some quality time with your family. That should be a great de-stress. Or go for a walk, or go for a drive, a long drive, something that you adequately de-stress yourself. Okay. So try to divide your study pattern. Like for example, by this time at least each of you will have at least one minimum study partner, I hope. And or if you have more than one, it's absolutely a great pleasure to have more than one. If it's a group study, like 3 or 4 would be excellent, but at least one should be readily available as a study partner by now. So divide your timings, so that morning you set for, say for example, 3 to 3.5 hours. Do some recall questions, like take any module. For example, you take urogynecology, or you take maternal medicine. So you do all the recall tasks of that particular module with your study partner. Prepare a schedule for yourself. Okay. So that it suits you and your study partners. Okay. And see, for example, morning schedule, you sit 3 to 3.5 hours or 4 hours. Try to do all the recall tasks of 1 or 2 modules, whichever is adequately possible. Try to take a break, and then sit for the afternoon session. Take again 2 to 3 hours time, and do it, and then take a small break in the evening, and then do late evening studies or a late night study. Okay. So try to divide your study timings into 3 or 4 shifts, so that you don't get exhausted or tired or overwhelmed. It's very easy to get overwhelmed. It is very easy to become irritable. It's very easy to become mentally exhausted. It's all part and part of this exam. So that's why I always encourage my candidates to take adequate breaks. At the same time, that breaks it should be really rejuvenating, not like you feel you continuously see your Facebook reels or YouTube reels and then get exhausted. It should not be such things. Try to have a good sleep, or listen to some good music, go for a walk, or spend time with your family, or enjoy with you. I mean, play around with your kids. Try to do some such breaks. And 48 hours before your date of exam, completely unwind everything. Stop your all your reading, stop all your preparations. Basically, I would say just listen to, if you have, recording. So how I will do, the second thing before I come to this, just before the exam, what I would say for my candidates is, so whatever you're preparing with your study partner, please do a video recording of try to do in Zoom or Google or whatever is your platform of study. Try to do a video conferencing, even if you're sitting along with your friend and doing a face to face, please record it. Okay, please record it in your mobile or her mobile or whatever it is. Why I'm telling you this is, when when you're getting some free time, you can go through your own recording and you can find out your mistakes or your study partner's mistake, and always be very honest in giving feedback to your study partner. Okay, and also tell her to give us honest feedback. Okay, it should not be okay, everything is good, okay, everything is bad. No, it should not be that way. It should be honest feedback of everything, including your presentation, your voice, your tone, your facial expressions, your body language, everything has to be given an honest feedback by your study partner, and try to record it and listen to that whenever you want, you're feeling sleepy, you're about to go to bed, you just listen or read, glance through that video, so that you will be, that gives a very good improvement, especially in the last few weeks. Okay, and it's always see to that your timer is on and never exceed your time. That is very, very, very important point that I want you to understand. Okay, so you have all studied so hard, you have all studied, sacrificed so many things, spent your money, spent your time, spent your energy, sacrificed so many things, including your family time. So it is the time to, write the whatever you've invested, is the time for you to ripe the fruit of it. That important, the last leg or the last step of this exam is this last few weeks. And that's the main important thing that I all wanted you to come for a session, because I've been telling this to all my candidates, to all my, my course candidates. They know it very well. That's how we practice them. But for those candidates who are not under me, so this is the time that I really want you to take home all this information. You may be under different mentors, doing under different courses. I don't mind all those things, but it is a general thing that I want you to understand. Very, very important thing, take home message is, these last minute tricks and tips is the one which fine tunes you, and that fine tuning is very, very important for this exam. Okay, right. So I always tell my candidates to aim for any task, to aim and finish it by 9 minutes. Aim and finish it by 9 minutes. Okay. So when you finish by 9 minutes, you have the last 1 minute for the role player to ask the questions. I always tell my candidates, especially when you are having a simulated patient task. Okay, take the agenda fixing, the introduction, the confirmation of the purpose, the agenda fixing, try to finish within 1 minute. Okay, your maximum time should be 50 to 55 seconds. Then comes your information gathering, which includes the history and examination and investigation. Give 3 to 3.5 minutes. Okay, and the next is the applied clinical knowledge, all your management and applied clinical knowledge, your patient giving information leaflets, winding up the session. That should complete by 4 to 4.5 minutes. So the total task has to cover by 9 minutes. And please give 1 minute for the role player to raise the questions. Remember, my friends, the more the role player talks, the more marks you will gain. Okay? So give the role play to task. Even, see, you would have get a very, very simple task. Candidates don't fail because of the difficult tasks. They fail because of the easy tasks, because they tend to overlook, oh, this is a very simple task. Oh, this is maternal medicine. Oh, this is urogynecology. Oh, this is a male fertility, infertility. I've done this 200 times with my study partner. I've done with my mentor 5 times. I've done with so and so with 8 times. I've done so many mocks. So I'm just going to do as a cakewalk. Yes, I do agree your confidence, but never become overconfident, because being overconfident makes you overlook your mistakes. Okay, so please don't do that, because whenever there's an easy task, remember there is always a small niche in it. There is always a small niche in it. There is always a trap. You should be very alert. Otherwise, you will miss it. Okay. So for that, what you should do is basically you should be very alert in allowing your role player to ask you questions, because the ninth minute only they will raise some questions. And that is the time you will be totally exhausted thinking that, okay, I have completed this task. Everything I've answered in this, keeping in mind of what your early preparations. Okay. So that is where you have to be very alert. And that is why I'm saying, please wind up your task by 9 minutes and give 1 whole minute for the role player to ask the question. So basically, the role players are not real patients, as you know, they are drama artists. Okay. So they are very trained actors. Okay. So they have their own script, they have their own dialogues, they have their own emotions to display. So it is not only how you speak, it is not only what you speak, you should know how you speak and what is your voice modulation, what is your tone of presentation, what is your body language, what is your facial expressions. Okay, that is why I am telling you to record your own preparations with your study partner, your own presentation with your study partner, and take a honest feedback from your study partner and give her your feedback. That is very important. Hang on, guys, just a second. Getting a call. Guys, is my slide visible? Guys, is my slide visible for you? Okay, yes. I need someone to reply. Otherwise, I'll think it's just a monologue and not a dialogue. I need you to participate interactively. Just tell me if my slides are visible. Right. Yeah, thank you. Thanks, Rajini. So I said told you this is what, like, keep one minimum study partner, 2 or 3 will be ideal. Split your study time into 3 sessions, one morning, one afternoon, one night. Yeah. So morning tasks generally do some repeat tasks. Afternoon, you can do some book stations. The night, do some random tasks or just do some quick talks if that's possible. Always make a video call and do video presentation with timer and record them. So as I told you, just arrange your holidays 2 to 3 weeks and, arrange everything at family. And I told you everything for that. Right. Also, yeah, we were talking about how you express your facial expressions and everything. So, yes, why I'm telling this last 1 minute is, if you don't alert that 1 minute for you, that is where they will keep you an edge, and you will not be able to complete that particular task without answering that question. Okay, so I always tell my students, you could have prepared these tasks 200 times, but always sit with the open mind. Always sit with the open mind. If you don't sit that open mind, you will be just carried over, or your mind will be so blank that you will not be able to answer to the question. And that is where they really test your knowledge or test your skills. So as I told you, these are the timings that I told you. Agenda fixing 50 to 55 seconds, information gathering, the history examination investigation is 3 to 3.5 minutes, applied clinical knowledge 4 to 4.5 minutes. Here I've written a specific terminology. That's how I coach my candidates. It's always customized, tailor-made knowledge for that particular task or that particular station or what the role player asks for. Okay, so it is not a generalized template or a generalized format. Have a generalized format in your mind, no doubt about that. You have to talk from the template, no doubt, but you should know what applies to that particular scenario or what the role player is going to ask you. Okay, that is where you will be judged. Okay, and as I told you, give 1 minute for the role player to raise the questions. The more the role player asks, the more marks you will get. In structured discussions, always do not forget the SBAR, situation background assessment and recommendation tool wherever required. And always, this is an exam of justification. You should be able to justify each and everything that you are going to say to the role player or you're going to say to the examiner. This is an example of justification. You just cannot say everything by memory or telling it by heart. It is not a viva voice where you have a general template, memorize everything and then reproduce from your memory. No, this is an exam where you have to be alert. You have to justify whatever you are saying. So structured discussions, generally, they are not at all a problem. But the only thing is you have to read through the scenario very clearly and take notes and answer. And you should expect what they will ask from you. That is where your preparation or your fine-tuning occurs. Okay. So that's why I generally conduct a session for my candidates, what is called a smart hour. So I give them small mini tasks to present within the 2 minutes, 3 minutes. I give them, that challenges within that time pressurized environment, and they come out very beautifully with very, very good marks. So that's why I generally do for all my for my course candidates. However, remember for the labor ward, always you should be able to alert. You should be able to see at the most 10 to so I'm recording it, Susan. So you need not have to record yourself. The recording is already going on, and let me share in the group.
Okay.
So remember the labor ward. Even if it's a top priority task, it's a high priority task. You can give at the most 1 to 1.5 minutes and nothing more than that. Some rooms they just need 30 seconds, but see to that you address each and every room. Okay. So, say for example, they'll say some room is closed for cleaning. You should be able to say that. You cannot just skip them. Room number, say, let us say room number 5 or delivery suite number 5 is closed for cleaning. So in your presentation, you should also say that room number 5 is or delivery suite number 5 is closed for cleaning. Okay, because you are the team leader, you are the labor ward in charge, so you should have a strong. You should have a very good knowledge of what is happening in each and every room. The gynae wards are generally, at the most 4 to 5 tasks, and you will be definitely having adequate time. So you can give 1 to 1.5 minutes and then wind up everything and summarize. Okay. So be alert when you do labor wards. That is very, very important. Okay. Right. You want me to do, you want anything to ask about how the tips and tricks for, you want any more ideas or you want any more guidance about this last minute preparations? I'm happy to answer them. Right. If not, let us proceed with a few tasks here. I hope all of you would have gone through all the clinical governance. We conducted a workshop as well. A few of you had who are here already participated, so they will know what they generally ask. But remember to read your critical appraisal of audit. Remember to do an audit. To present an audit, remember to do a critical appraisal of an audit. Remember to do a critical appraisal of a patient information leaflet. Remember to do a critical appraisal of an RCT or a scientific impact paper. That's very, very important. And remember to do a maternity dashboard. That's again very, very important. And remember to do risk management. That is again the fishbone model, the Swiss cheese model. So everything is very, very important. So audit and clinical governance, you can never afford to miss. And remember to do teaching tasks. Most of you are going for the face-to-face session. So definitely you'll be given props, you'll be given dolls and pelvis. So you'll be given kibi, you'll be given forceps. So remember to, if you have access in your hospital, try to do hands-on practice with your study partner. If you work in a hospital, or if you own a hospital, whatever, wherever you work, you can just take 1 or 2 hours, go with your study partner. You'll be doing the daily in your in your preparations. I mean, in your job, like you'll be doing QBs and you'll be doing forceps. That's not the beauty, but it is the important of how you are able to teach to a junior colleague. So that is this examination. It is not that they are going to ask you to conduct a forceps delivery, or they are going to ask you to do a QV delivery. It is how you are going to teach a junior colleague is being assessed in this exam. Remember, I always tell my students who work this part 3 examination is not a part 2 examination. Is a different thing where you will be just analyzed for your, or tested for your knowledge. This examination is where you will be tested for all the following things. What are the following things? I will let you know. So there are 5 things you are expected to perform, or 5 things where you are tested on the grounds of. Okay. So what are those 5 things? I will let you know. So if you can see my slide. So remember, points to understand about this exam is you are expected to be a safe, a knowledgeable, an empathetic, ST5. ST5 is a middle grade doctor with good communication skills. Okay. Safe, knowledgeable, empathetic, ST5, that's a middle grade doctor with good communication skills. It's a common platform as far as this exam is concerned. So remember, you might be a consultant in your own place. You may be a just fresh postgraduate, or you may be somewhere in the middle age with a middle grade job.
Ma'am, we are not able to see your screen, ma'am. Yes, ma'am. Thank you, ma'am.
All right. Thank you. Yeah, so it is but here when you come to the exam, you are a middle grade ST5 level doctor. So it's going to be a common platform. You have to remember just for the sake of the exam. Okay. And second thing is your clinical, your leadership, your managerial, and your teaching skills are being tested in this exam. It's not just you're a clinician. So remember your clinical skills, your leadership skills, your clinical skills are being tested on all the simulated patient tasks, and your structured discussions and everything. Your leadership skills are being tested in your labor ward prioritization and your gynae ward prioritization. Your teaching skills are tested in how you teach your junior colleague, and your managerial skills are tested on all your clinical governance, your risk management, and how you behave as a manager in the unit is being tested. So all your 4 things, your clinical, leadership, managerial, and your teaching skills are being taught in this exam. Okay. So even if you have not known this fact before, try to approach this exam with this one. This is what I teach my candidates right from the beginning of the part 3, for my part 3 course preparations. So, but at least now for all the general candidates, just remember, this is how you should approach this exam. It is just not a Viva voice. It's just not anything reproducing from your memory, but it is something more than that is being expected of you. Okay. So any questions at all so far? I'm happy to answer. Everybody's thorough? No questions at all? Right. So let us go for some important tasks. I don't want to do the routine tasks, and which everybody would have done so far, but I want to give you some important tasks which may be or may not have been discussed, or which you would have come across very least number of times. Okay. Let me open my slides. Dr. Manikim, would you like to say anything to our candidates, for the exam going candidates?
No. No, ma'am. It is usually the study partner. That message is so good, ma'am.
Yeah.
Doing with the study partners and continuous feedback from the study partner and attending all the sessions of all the mentors. This only helped me to this tide over the crisis of this exam, and I was successful because of study with the study partners and attending the meetings, ma'am. Thank you, ma'am.
Thank you very much, Dr. Manikim, for sharing your experience.
Mm. And ma'am has given so every session she will give me a chance to present a case. And she has
Oh, that's my
offered
pleasure.
she has offered the chance of attending the clinical governance session also free of cost, and it helped me a lot. Thank you, ma'am. I'm really very thankful to your.
Oh, thanks for your kind words, Dr. Manikim. It's my pleasure.
Thank you, ma'am. Yes, ma'am. Thank you.
Right.
And she was willing to register for me also. So nice of your every thing towards me, ma'am. Thank you,
Oh,
ma'am.
thank you so much. That's fine. It's my
Huh.
pleasure again. I'm happy to do. I'm doing for so many people around, and I'm happy to do for everybody as much as possible, as much as I can. Right. So let us go for some tasks. I'm just looking for a slide. Okay. Right. I've got certain important, difficult topics. I'm just looking for, yeah, I did it 2 days before for my course candidates. Just hang on a second. Those tasks are very, sometimes I would say, demanding, difficult tasks where generally candidates might, they know what to talk, but the difficulty comes how to talk. Yeah. So yes, we are just running a bit short of time. I would do one thing. I'm going to post you another link. And you can all join in the next link that I'm posting because the recording will finish now and I don't want to hang my cloud with this recording. So I'm just going to sign it off and I'll meet you all with this new recording, please. Okay, with the new link. I'm posting the new link now. Okay. Thank you so much for joining. Please join the new link, which will be posted now in the group. Okay, Telegram group. And some of you might have got the link from your friends. But all the links are being posted on the group, and you can join them. All right. Thank you very much.